Hello beautiful people and welcome to the channel. My name's Reverend Debbie and I talk about all things to do with narcissistic, abusive and toxic relationships, as well as looking at healing from them. And in today's video, it's the second part of my What If series, and this is what if the narcissist works in the medical profession. Again, this was another question that came up in one of my comments in one of my feeds. And I thought this is a really interesting subject to talk about because my ex was in the medical profession. And looking back on the work that he did, I can see why a narcissist would be attracted to this kind of profession. So before I get into the details and the body of the video, if you enjoy it, please click the like button, please subscribe to the channel, please get some more subscribers for me, please. I would really like the channel to grow so that we can get this education out to other people out there. So one of the vocations that a narcissistic personality type is attracted to is the medical profession. Generally, they go for high positions and want to be the top dog, but some of them go into the low positions of nursing, for example. So those who go into the higher positions, such as surgeons or, doctors who are really high in their field, tend to be grandiose narcissists. These are the people that will drive the flash cars, live in a big house, think that they can do no wrong, think they're the bee's knees, walk into the operation theatre with the scalpel and, they just think they're brilliant and they know everything. And I suggest you go and watch a series on Netflix called Dr. Death. It is really, really good. It's based on a true story. I think it's Joshua Jackson in the lead role, and he does a really brilliant, he plays a really brilliant part in that. But that will give you a much clearer identification as to what a grandiose narcissist is like. They can do no wrong. They know everything. They're the best in their field, and they know it, and they use it. They will use that grandiose narcissism to ply their fellow workers with romantic options, even if they're married. I'm not saying that all surgeons, doctors are narcissistic. Definitely not. But some of them truly are narcissistic. And because they think they're the best at what they do, they may well make stupid mistakes. So watch Dr. Death. I really recommend it. It's very good. The grandiose narcissist may well be very close to a psychopath in this situation because a psychopath wants to hurt people. They are fascinated by the pain that they cause, whether it's animals, people, whatever. It's part of their supply. And the grandiose narcissist has a very similar pattern, but not to the extreme of murder. So we have the grandiose narcissist being attracted to those top positions. And then we have the covert narcissists who go into the medical profession. And many covert narcissists may well start off on a lower level, such as a nurse or a carer, something along those lines. But why do they go into that profession? Because they like to see people suffer. It's what feeds them. It's part of their supply. It gives them control over people. So, for example, with their medication. Yes, we know that in a hospital there is regulations and patients are given medication at certain times and so on and so on. But it may well be that this nurse, doctor, whomever, is not giving the patient the right medication deliberately to see them suffer even more. And they will love to watch a person passing. It is the ultimate supply for them. Now, again, I want to stress here that not all doctors are narcissists. Not all nurses are narcissists, okay? It's a very small handful here that go into this. The vast majority of doctors and nurses are caring, loving, giving people. So I am not in any way disputing or disrespecting the medical profession. I am talking about those with narcissistic personality traits or who do have NPD. So the covert narcissist is going to do things in an underhanded way. As I say, they will be as nice as pie when everybody else is around. But in the middle of the night, when they're caring for this patient and the patient's asleep and rings their buzzer and needs to go to the toilet, the nurse or carer may well ignore it and wait for them to soil themselves because it gives them that level of control. They're controlling when that person goes to the bathroom or takes their medication. They'll show small signs while they're doing this. And as they become familiar with other staff members, their mask will begin to slip sometimes. You know, they may well try to hit on a fellow nurse or a doctor or a cleaner or a carer, whatever. Because the narcissist, no matter whether they're covert or grandiose, believes that they're the best at everything that they do. And everybody else is useless and rubbish, and what they say goes, and you can just bugger off. They like to see people in pain. They really do. The covert narcissist, that is. The covert narcissist will also gaslight. Gaslighting is a trait that the narcissists have that is, you know, they are so good at it. They really, really are. It's unbelievable how good they are at it. And even I fell for those behaviours. But ultimately, the narcissistic personality type will be drawn to this type of work because of the recognition they will get. If they've looked after a patient, you know, whether it's a grandiose or a covert, they will feel good about themselves if they've saved that person's life. They've done the best job they can, which is a good thing. But they may also take it a bit over the top. Remember, they will gaslight and manipulate as much as they possibly can. Talking about grandiose narcissists, I went to my doctor's surgery recently and saw one of the doctors there, a doctor I'd never seen before. And he was incredibly nasty to me. And I actually said, look, I'm going to get up and leave because I don't want to deal with you, which was my right as a patient. Remember, as a patient, you can choose your healthcare provider. If you are not happy with the way you're being treated, you can say, right, don't want to see you, I'm going to see somebody else. You always have the right to see a second doctor or a third doctor, however many doctors you like. So, you know, if that doctor is hurt by your, you know, I'm not seeing you, that's their problem, not yours. Anyway, so this doctor was incredibly rude to me, incredibly nasty. And as I got up to leave, he gaslighted me. And I said to him, and now you're gaslighting. And he went, he sort of realised that he was gaslighting. And as I walked out of the office, I was so tempted to slam the door behind me, but I didn't. I left quietly and peacefully, but he shouted down the passageway to me, you're the reason that the NHS has no money. No, I'm not. That's the government's fault, but that's a conversation for a different day and a different channel. But later I found out that this man was one of the shareholders of the practice that I'd gone to. Definitely narcissistic traits there. Whether he is a narcissist or not, I do not know. But he was definitely gaslighting me. He was talking to me in a condescending manner, and I just thought, no, I'm a yoga instructor. Granted, I haven't taught yoga for a few years now, but when I was teaching yoga, I always said to all of my students, you know your body better than anybody else. You live in it. I know that I have pains in my neck. Other people don't know that. A doctor wouldn't know unless they examined my neck. It's just an example. So don't believe every diagnosis that the doctor tries to give you. take care of your own health. Definitely take care of your own health. And for those people who are trapped in a narcissistic relationship with somebody who is in a medical profession, they are probably going to be made out to be crazy, probably going to be made out to be insane, the crazy one. You may well find yourself being put into hospital for mental health issues. But your mental health will definitely degrade when you are with a narcissist, and that's any narcissist, not just a medical practitioner. They will, as I say, gaslight you. They will try to harm you. The best option you have, if you have a partner who is in the medical profession, is to leave. And I know how hard it is. I really do. Because I've been there. And it is incredibly difficult. But if you've got this person making you crazy, because don't forget, crazy making is part of the narcissistic pattern. You know, they will, it's part of their pattern to make you crazy because they want to lord it over you. They gaslight you to make you think that you are going crazy. You're not going crazy. The narcissist is abusing you. So if you can get out of that relationship, do get out of that relationship. If you can't, grey rock. Just grey rock them. Don't respond to them when they start with their gaslighting techniques. Walk away. Go out for a walk. Get in your car and drive somewhere. Go see a friend. But don't let them bait you in that way. I hope you've enjoyed the video. If you have, please click the like button. Please subscribe to the channel. Pop some comments below if you've experienced this or know of anybody who has. I'd love to hear your views. I hope to see you next time. Blessed be.